CNS high yield basically refers to those CNS drugs that have very significant side effects. Now, the benzodiazepines basically are GABAergic modulators, and benzodiazepine overdose does happen, and usually it is presented with bradycardia, respiratory, and CNS depression, and it is antagonized with flumazenil. Barbiturates in high dose can be directly GABA-mimetic and extremely fatal. Alprazolam and clonazepam used for panic attacks, and SSRIs and SNRIs for generalized anxiety disorders. Lorazepam and oxazepam do not form active metabolites. They undergo direct conjugation and therefore have less residual effects, and they do not accumulate. Buspirone is a partial 5-HT1A agonist used for the treatment of anxiety if you do not wish to have sedation or in pregnancy. Alcohols, ethylene glycol, causes very serious nephrotoxicity and renal failure, and methanol, irreversible blindness. Fomepizole is the specific antidote, and in its absence, ethanol can be infused up to 100 milligrams per deciliter. Disulfiram can be used to deter alcohol. If alcohol is taken in the presence of disulfiram, this causes the acetaldehyde syndrome, which is severe nausea, vomiting, and migraine-like headaches. Also remember that metronidazole, cefoperazone, cefotetan, and griseofulvin can also cause disulfiram-like reactions. Anticonvulsants basically are powerful inducers of the cytochrome P450 system except valproic acid, and will cause therapeutic failure, particularly oral contraceptive failure. Carbamazepine is a very potent self-inducer, and all anti-epileptic drugs are highly fetotoxic and terogenic, and phenytoin causes gingival hyperplasia and also osteomalacia and megaloblastic anemia. Valproic acid is an inhibitor of the calcium channel and can cause very serious hepatotoxicity due to the accumulation of 2-propyl 2-pentanoic acid. Now, in the anesthetics, nitrous oxide can cause hypoxia and spontaneous abortions. Halothane is well known to cause malignant hypothermia, the rigidity, hypothermia, hypertension, acidosis, and the complete rigidity. This is due to excessive calcium release and is treated with dantrolene. Propofol can cause hypersensitivity reactions, and remember that all the esters are metabolized by neuromuscular blockers or skeletal muscle relaxants. The non-depolarizing is atracurium and mivacurium. They're antagonists of the nicotinic receptor at the neuromuscular junction. They're reversible with acetylcholinesterase inhibitors. Atracurium undergoes Hoffman's elimination of spontaneous breakdown to form laudanosine, which accumulates and may cause seizures. The succinylcholine is the only depolarizing blocker. It's hydrolyzed by pseudocholinesterase, and it can cause malignant hypothermia due to mutations in the ryanodine receptors. This is typically treated with dantrolene. Opioid overdoses do happen. Opioids are mu receptor, act at the mu receptor and cause GI effects, which is inhibition of presynaptic firing in the spinal cord and postsynaptic firing in the brain. Morphine is the longest acting and the only drug that undergoes glucuronidation to form two active metabolites, morphine 6-beta-glucuronide and morphine 3-beta-glucuronide. They are contraindicated in increased intracranial pressure and pulmonary dysfunction. Morphine particularly will cause histamine release. Opioids typically cause meiosis, constipation, urinary retention, a reduction of uterine tone, and in higher doses respiratory and CNS depression. They antagonize with naloxone. Meperidine is shorter acting. It can usually be used in pregnancy, but meperidine gets metabolized to normeperidine that may accumulate and cause a serotonin syndrome and seizures. Methadone is indicated for the treatment of opioid addicts. In Parkinson's disease, there's a degeneration of the dopaminergic neurons in the nigrostriatal tract. L-DOPA with carbidopa is given to increase dopamine, and carbidopa prevents the L-DOPA metabolism. Selegiline has the fewest of side effects and is a monoamine oxidase B inhibitor. COMT can be inhibited with tolcapone and tacapone, but tolcapone is extremely hepatotoxic. And amantadine is a rescue drug, which is a dopamine agonist and can cause libido reticularis, as a side effect. Eventually, the cholinergic antagonist bromocriptine trihexyphenidyl can be used, and diphenhydramine use is usually encouraged because of its sedating potential and antimuscarinic effects. Antipsychotics is basically psychosis is due to overactive dopamine system, and the positive symptoms are delusions, hallucinations, and paranoia, with negative symptoms associated with anhedonia, depression, and withdrawal. So you have the typicals, which are the TD2 blockers, but have a very significant muscarinic block and alpha block, thus causing heart rate issues and reflex tachycardia and autonomic nervous system instability. And they are associated with lip smacking, tongue protrusion, fly catching tongue, and lateral jaw movement, which is all unwanted EPS effects. Antidepressants, depression due to the biogenic amine theory. There is insufficient catecholamines. Tricyclic antidepressants block the reuptake of norepinephrine. They're also used in neuropathic pain and enuresis, and they're associated with the 3 C's side effects: coma, convulsions, cardiotoxicity. They can cause sodium channel blockade, orthostatic hypotension, cardiac conduction delays. Monoamine oxidase inhibitors, phenelzine and phenylcypramine, do never combine any of the antidepressants at the risk of serotonin syndrome. And monoamine oxidase inhibitors, patients should not be given tyramine containing products. The most effective, efficacious are the SSRIs, fluoxetine and paroxetine, but they too have their typical side effects, which is basically suppression. And the typical side effects of the SSRIs is also bruxism and a loss of libido, and they can inhibit the cytochrome P450 system. Lithium is indicated in bipolar disorders, and however, lithium causes very serious nephrogenic diabetes insipidus, tremors, hypothyroidism, and seizures. Serotonin syndrome can be debilitating, caused by SSRIs, combination of antidepressants, or combining it with meperidine and St. John's wort, associated with sustained rapid eye movements, overreaction of reflexes, relaxation of jaws and ankles, and this is treated with cyproheptadine.